Time now for a look at your health, and we're going to be very topical here because there's been a lot of talk recently about nuclear radiation. But what exactly happens to a person when they are exposed, and where are all those nuclear test sites around the world that were so dangerous back in the day? Where Dr. Mitchel Goldman from UCSD studied this topic at length and joins us to discuss what he found out. Well, thank you for being here. With the Japanese reactors that have been literally going south and cores potentially exposed, radiation leaking, all of these scary things that are being said, you said the risk is still very low, especially compared to all these nuclear test sites and what we used to do.
Yes, it's very responsible that the media is being so on top of this situation to alert the public, but we really have to put it in perspective. In the 1950s and 60s during the Cold War, millions times more radiation was released in atmospheric testing than has been released from Chernobyl, 3 Mile Island, or now in Japan. So we put it into perspective.
And where are those test sites?
Well, there's test sites, literally they were all over the world. In the United States, we had test sites, 120 atmospheric tests were done in Nevada. There were tests done in Colorado, in Alaska, off the Atlantic coast. So during the 50s and 60s, the U.S. population was exposed to millions of times more atmospheric radiation than we're exposed to now.
And you wrote a paper back in the day on how to handle that kind of exposure. So what are doctors supposed to do across the U.S. with radiation?
You know, it was really funny. When 3 Mile Island came out, I was in medical school, and so I went to the dean and said, what are we supposed to do? And this is Stanford University. They had no clue. So we organized a symposium. I wrote a paper on it, published in '81, and nothing's changed. So essentially, there's not much you can do. Absolutely, if you get exposed to nuclear material, you have to wash it off with soap and water. That's as easy as it gets. And if you are exposed to the radioactive iodine, then you take the iodine pills. But you don't take them now. And if you are exposed, you have to continue taking it while the radioactive iodine is in the air. But that's not the most dangerous product, because the radioactive iodine literally decomposes and goes away within about a week. It's the plutonium, the strontium, the other radioactive particles that are much worse.
Yeah, and plutonium's been mentioned lately because now they're saying that there's toxic levels of that due to the reactors being damaged in Japan. So what's your take on that?
Well, plutonium is dangerous, but fortunately plutonium loves to bind to minerals in the soil. And so when plutonium gets released, even if it's in the groundwater, it's going to stay in the soil. It doesn't get into the groundwater. We're not going to be drinking it. If you grow crops in it, of course, I wouldn't be eating those crops, but significant amounts of radioactivity do not even get into the crops that well. So it's not as bad as we all are led to believe, but it's really scary, and that's why I would rather stay away.
Yeah, and certainly some of the Japanese imports are now being stopped, but I mean, because of radiation levels, but you're saying even if they did get through, it's still a minimum danger?
It really is. We have to just put everything into perspective. The amount of radiation being released in Japan is real, but it's far less than that could be possibly toxic to anyone, and much less that we in the United States were exposed to during the 50s and 60s.
Okay, very interesting perspective. Thank you very much, Dr. G, as we like to call him. So we'll send it over to, well, who I like to call Encyclopedia Brown. This is the other one that knows it all, Lauren.
I was sitting here taking notes. Thanks, Dr. G. That was good stuff.